At any given time, there are about 5,000 kids in foster care in Oregon. A mother in Malheur County says she wants to take care of some of them. She wants to adopt 2 kids from foster care, but the state won't let her because she disagrees with state requirements that she support the sexual orientation or gender identity of her adopted children. She says that goes against her religious beliefs, and now she's suing the state of Oregon. Jessica Bates has 5 biological kids already. She's a single mom. Her husband was killed in a car crash in 2017. She's also a Christian. And she says that after listening to the radio one day, God told her to adopt more kids. She decided she wanted to adopt 2 kids, siblings under the age of 9, from foster care in Oregon. And when Jessica went to fill out her forms for her home evaluation, she got hung up on one section. Oregon's Department of Human Services requires the certified foster homes respect, accept, and support the race, ethnicity, cultural identities, national origin, immigration status, sexual orientation, gender identity, gender expression, disabilities, spiritual beliefs, and socioeconomic status of a child. Bates decided that supporting sexual orientation and gender identity, that goes against her religious beliefs. She sent a note to DHS, to the person handling her application actually. She wrote, "I need to let you know I cannot support this behavior in a child. I have no problem loving them and accepting them as they are, but I would not encourage them in this behavior. I believe God gives us our gender, sex, and it's not something that we get to choose." She went on to say that she believes that providing gender-affirming medical care like hormone shots is child abuse. Well, after that, Bates' application to become a foster parent was denied. Now she's suing the state, trying to overturn that rule. She's represented by the Alliance Defending Freedom. It's a conservative law firm that works on Christian religious freedom cases.
Jessica went through the process, and that was the only reason she was excluded. She was not excluded because she would not effectively care for children or anything like that. She was excluded because she would not essentially bow down to the state's orthodoxy on this principle, that she would not, in theory, say that she would affirm practices and beliefs that she disagreed with, even if the child that she wanted to adopt didn't care about those issues.
DHS requires adoptive parents to meet the current and lifelong needs of the child's physical and emotional safety and well-being. The Oregon Foster Child's Bill of Rights states that children in foster care have the right to determine and express their gender identity, dress themselves accordingly, and have a say over decisions about their body when it comes to medical care. To get some more context on this, we reached out to Basic Rights Oregon. They're a local advocacy group for LGBTQ plus Oregonians. We talked to Blair Stenvic, who is also a foster parent.
You know, these kids don't need to be walking into something where their identity is going to be politicized, or they're going to try to be forced to fit a mold that they just aren't going to fit into. They just need a home that's accepting and affirming and open-minded. I think in general, foster parents and adoptive parents need to be open-minded, because you're going to be getting a kid who has already been shaped by other environments outside of your own, and they're going to have their own identity coming into your home. And your job should be to support that and help them become the best version of who they are and can be, not force them to mold into who you want them to be.
According to a survey by the Trevor Project, which promotes LGBTQ plus rights, 71% of those youth, including 86% of trans and non-binary youth, say state laws restricting the rights of LGBTQ plus young people have negatively impacted their mental health, and that policies banning gender-affirming medical care make them feel angry, stressed, sad, hopeless, and scared. For LGBTQ kids who've gone through the foster care system, the risk is even greater. Those youth who reported having been in foster care had 3 times greater odds of reporting a suicide attempt in the past year.
We know that there's an outsized population of queer and trans kids in foster care. I think, according to one recent study from the University of Maryland looking at national data, it was almost a third of kids in the foster system identify as LGBTQ plus. We know a couple contributing factors to that can be that, kids don't feel accepted in their home, and they might be, abused because of that. They might be kicked out or choose to run away. They may, because of their identities and feeling marginalized, seek out drug use or homelessness or other unhealthy things that might lead to them becoming DHS involved. And so because of that, because there's such a need, on top of that, that's why it's doubly important that foster and adoptive families are open and supportive and affirming.
We reached out to DHS. They told us they can't comment on the lawsuit, but they also said the Child Welfare Division stands in support of transgender, non-binary, gender fluid, and other LGBTQIA2S+ children, young people, and families, including those who are in foster care and those who've been adopted. The statement continues, at a time when gender diverse people, policies, and laws are under attack, it is important to reinforce our values and practices related to the children and families we serve. We are committed to creating a safe and supportive environment for all children and young people, regardless of their gender identity. Now it's your turn to weigh in. Should the state be able to bar potential foster and adoptive parents because they don't support LGBTQ rights, or should their religious beliefs outweigh state policies? Shoot us an email, will you? The address is thestory@kgw.com, or use a voicemail. Leave us a voicemail. The number is 503-226-5090.